And welcome back. I'm Mabel Jong. You're watching live coverage of the World HealthCare Congress on WHCC TV. Thank you so much for joining us. And we're going to learn a little bit about the Healthcare Executive Group. The Executive Director, Ferris Taylor, is here. Welcome.
Thank you, Mabel, and it's a delight to be with you. I understand you're from Boston. The Healthcare Executive Group started in 1988 in Maynard, Massachusetts, when a mini computer manufacturer disbanded their healthcare users group.
Okay.
That group of users said, forget about digital equipment. We find value in networking, being able to share the challenges and the opportunities of healthcare, to have somebody around the country that I can pick up the phone and call and say, hey, I'm having this problem. And if my colleague in Minneapolis says, I'm not having that problem, maybe there's something wrong with me, or maybe we have something to talk about.
Okay.
Or if we both have that problem, how are we solving that? So it's a small network, 100 members or so, primarily technology leaders in their organizations, payers and providers, that find personal, professional, and organizational value in sharing ideas about how to address the challenges in healthcare. And as you know, we have lots of them.
Lots of them. And in terms of sharing ideas, you also have done a lot of research on coming up with a top 10 list. Not David Letterman's top 10 list, but
started out that way.
Okay. Share with me what this list is about and who makes it.
And it's fascinating because from the very beginning, there was always conversation about the challenges in healthcare. And 10 or 15 years ago, the CIO at Health Partners, Alan Abramson, said, you know, when I go home from our meetings and like that, my executives ask me, what have you been doing? What have you been talking about? And I tell them. But there would be value if we actually went through a process and shared with the industry what our members see as the challenges in the foreseeable future in healthcare. So about 15 years ago, we started publishing, and at the time it really was the David Letterman. We keyed on that,
okay.
But here's our top 10 list. And it's evolved over, the members at the end of the year actually vote from 30 or 40 issues that we've talked about in the year, what their top 10 are, and then we go through an issue of ranking them. And it becomes the benchmark that our members use, and I recommend that other companies around the healthcare stakeholders around the industry use, to say, am I addressing these issues? Are they on my priority list? What's my action plan with respect to those issues?
Okay, so does it go from most important to...
We do rank them.
Okay, so number 1, you have data and analytics, all the way to number 10, cybersecurity.
Security, that's a big range.
It is a big range. So people are saying these are the issues that we're currently facing and that we're concerned about.
Exactly, and another dimension of this that you don't see but is very important to me as an executive director is I can look back over time at how those issues have moved around. Up until 2015, cybersecurity wasn't on our list. And then you have 2 major health plans, 80 million member record breach, 20 million member record breach, 100 million members' records have been lost to the dark side.
So it makes the list.
It came onto the list.
Yes.
And the fact that it's number 10 doesn't mean that it's not important, but other things have become more important. Number 4 here is value-based reimbursement, and World HealthCare Congress this week has talked a lot about value and clinical appropriateness and price and those issues. 3 years ago, value-based reimbursement was number 1 on our list. You could say, well, it's dropped in importance, but in fact, if I look back over our conversations, and we have monthly webinars and do a lot of blogging, and then we have quarterly executive roundtables where we take these issues and discuss them. In our annual meeting, we spend a whole 3 days on the program. The discussion was, we can't get to value-based payments until we have a better handle on data, and in particular clinical data. We've got a lot of claims data, but we need the clinical data, and we need agreement on the measures and the outcomes and the data we're going to track before we can get to value-based reimbursement. We need to bring the consumer in. Number 2 is total consumer health.
Right.
Number 3 is it's labeled population health.
Yes.
We call it social determinants of health, but it's really the barriers to medical health that are non-medical, and we've narrowly defined healthcare as medical, and it isn't.
Well, and also at number 9 is opioid management.
And that's a new one this year.
Yes,
you can imagine that it would.
Right,
but it's a crisis.
And your executives are very concerned about this.
They are, and on all of these issues, they're corporate issues. And our discussions many times evolve to what are the systems? What are the data flows? What is the information? What is it that we're trying to track that will help our executive team address or better handle a crisis like opioid management? Mm-hmm. And from a technology point of view, you could say, well, that's a medical issue. It's not a technology issue. But in fact, in our data for a number of years, there were indicators that this was becoming a problem, and we didn't analyze it.
I see. Okay, so now that executives have outlined these as their concerns, what does your group do about that?
Well, and we're very action-oriented, but to get to action, you've got to be very sure you've defined the problem correctly and have the components of the solution in place before you take action. And so a lot of what we're focused on are, as a group, here's what I'm doing from a systems and a technology point of view to address each one of these issues. And their colleague in another part of the country, somebody that they don't compete against so they can be very open and sharing, are saying, well, I'm in addition to that, I'm doing this. Oh, I hadn't thought about that. I need to bring that to the table as well. And then they can go to their management team in a very organized and comfortable way, saying, this isn't just my idea. This is what a group of our colleagues that are similar to us are doing, and it gets better acceptance. It allows these things to become priorities within each company's competitive marketplace, because everybody's different, with their resources, with the focus that they have on healthcare. If you're a Medicaid plan, you have a different focus than if you're a Medicare or a commercial or a dual eligible plan. So it's the networking that leads to the actions that can take place here. So our closing session yesterday here at World HealthCare Congress was 2 of my board members, a board chair, Kim Sinclair from Boston Children's Medical Center, Alan Abramson from Health Partners, sharing with everybody here at World HealthCare Congress what they see out of these as their priority, and going into specifics. These are the things that we are doing to address the challenges that we've already acknowledged.
All right, Ferris, thank you so much for sharing your experience with HCEG. We appreciate it.
It's a lot of fun.
All right.
Thank you.
Fun is good. And thank you for joining us. Stay tuned. We're rounding out our last interview very shortly.